Imagine this. You're sitting in a doctor's office. You've just been told you have cancer. Your heart's racing. Your mind is spinning, and you're trying to hold it together. The doctor starts talking about treatment options, chemotherapy, radiation, maybe surgery, but something's missing. No one has told you the one thing you desperately need to know. Can this cancer be cured? Or is the real goal just to buy you more time? I had a patient in my obesity clinic today, yes, a weight loss clinic, who reminded me of why this conversation matters. She came in for weight loss, but as we talked, I learned that she had cancer that had spread beyond the original location, metastatic. And as I gently probed, I realized something shocking. No one had ever sat her down to have a simple, honest conversation about her goals of care. This isn't the first time I've seen this. In fact, I see it all the time. And every time, it shakes me. Because when we as doctors skip these conversations, we take away a patient's ability to make the best decision for their life. Today we're going to talk about why this happens, what needs to change, and most importantly, what you as a patient or caregiver can do to make sure this never happens to you. Let's start with what we even mean by goals of care. Goals of care is just a fancy way of saying, what are we trying to accomplish with this treatment? Are we trying to cure the disease? Are we trying to slow it down? Or are we simply trying to give you the best quality of life possible for the time you have left? It sounds simple, right? But far too often, patients never hear the answer. Instead, we rush into treatment, chemo, radiation, surgeries, powerful medications. And don't get me wrong, these treatments can be life-saving when they're used in the right context. But without understanding the goal, a patient might endure months of toxic side effects and hospitalizations only to find out the treatment was never going to cure them in the first place. This isn't just about comfort, it's about outcomes. There's actually research showing that when patients have honest goals of care, conversations, and are connected with palliative care early, they live longer. One landmark study published in the New England Journal of Medicine looked at patients with advanced lung cancer. Half got standard cancer care. The other half got standard care plus early palliative care. The result? Those who received palliative care lived nearly 3 months longer on average. And they had a better quality of life while they lived. So this isn't about giving up. It's about living as fully as possible, for as long as possible, on your own terms. Now, before we go any further, let's clear up the biggest misconception out there. Palliative care is not hospice. Palliative care can be started at any stage of a serious illness. It's focused on relieving symptoms, pain, nausea, depression, shortness of breath, and helping you and your family navigate incredibly difficult decisions. You can receive palliative care while you're still getting treatment for your illness. Hospice, on the other hand, is for people who are at the end of life, usually with a prognosis of 6 months or less. Hospice focuses entirely on comfort when cure is no longer possible, or when a patient chooses not to pursue aggressive treatments. Unfortunately, many people, and even some doctors, equate palliative care with giving up. That couldn't be further from the truth. Palliative care actually supports hope. It helps you hope realistically. It helps you prioritize what matters most to you, whether that's living long enough to see your granddaughter graduate or simply being able to stay at home instead of in a hospital bed. Palliative care isn't just for cancer patients either. It can help anyone living with a serious life-limiting condition. Here are just a few examples. Advanced or metastatic cancer, dementia or Alzheimer's disease, severe COPD or other advanced lung diseases, congestive heart failure that's getting worse, advanced kidney disease, especially those on dialysis, ALS and other progressive neurologic diseases, severe liver disease. If you or someone you love is dealing with any of these conditions, palliative care can make an enormous difference. And yet, it's underutilized because many patients don't even know it exists. Here's where I get frustrated. Hematology oncologists, the doctors who treat cancer, are some of the most brilliant physicians in medicine. They are literally fighting for people's lives every single day. But many of them are not comfortable having goals of care conversations. Some of it may be a training issue. In medical school, we're taught how to treat diseases, not how to navigate emotional and existential questions that come with life-limiting illnesses. Some of it may be fear of taking away hope. But here's the reality. Avoiding the conversation doesn't preserve hope. It creates confusion. If you're an oncologist and you don't feel comfortable having these conversations, that's okay. But then you have an obligation to refer your patient to someone who can, like a palliative care physician. In fact, I believe we should have automatic referrals for patients with advanced cancer and other serious conditions. Why should it be optional? Patients deserve this support. It should be the standard of care. Now let's shift gears, because the truth is we can't wait for the healthcare system to fix itself. If you or someone you love has been diagnosed with a serious illness, here's what you can do right now. Ask these questions. Number one, what are the goals of this treatment? Is it to cure me, slow the disease down, or just manage symptoms? Number two, is my illness curable? If not, what does the future likely look like? Number three, what will my quality of life be during and after this treatment? Number four, what happens if I choose not to do this treatment? Number five, can I meet with a palliative care doctor? And if the doctor hesitates or seems uncomfortable, advocate for yourself. You have every right to understand the big picture. One thing I often tell patients is, don't just ask what's the next step. Ask, where is this road leading? Because every treatment has a destination, and you need to know if it's a destination you're willing to reach. This isn't about blaming doctors. I truly believe most physicians want to do what's best for their patients. But sometimes we're trained to focus so much on the disease that we forget about the person living with it. I'm making this video because I don't want another patient to go through what my patient went through today. You deserve honesty. You deserve compassion. And you deserve the chance to make choices about your care that align with your values. If you're living with a serious illness, please ask your doctor for a goals of care conversation. Ask about palliative care. It's not about giving up hope. It's about making sure you live the way you want to live for as long as possible. And if this message resonated with you, share it with someone who needs to hear it. Because the more we talk about this, the more likely it becomes that everyone gets the care and the dignity they deserve. Let me know in the comments. Have you or a loved one ever struggled to get an honest conversation about your care? What questions would you add to the list I shared? And don't forget to click on the playlist in the description below for more videos about taking control of your health. And if you haven't subscribed, now's the time. Just click here. Or check out the video right here on the screen. I try to deliver the best content possible, and I will continue to do so. Together we can create a world where healthcare truly puts people first. I can't wait to see you in the next video.